class, and welcome to Jeopardy, the MRA Addition. The quiz show where doctors compete for prizes and the right to claim definitively that they know more than at least 2 other doctors. Let's meet our contestants. Hailing from the south, a man who never met a chicken he didn't want to dip in batter and fry. Please welcome Dr. Saunders. Now, I do declare, y'all, I'm gonna win this thing. He's got an MD and a PhD in literature, but we won't hold it against him. The esteemed Dr. Gupta.
Sometimes poetry is just as healing.
And last but certainly not least, she's twice as smart and works twice as hard as you. Please welcome Dr. Jenkins.
Professor Moriarty, you big flirt.
Today's topic: when is cancer really cancer? Now, class, as you know, the coding of a cancer diagnosis, like any other condition, is dependent upon the documentation submitted by the physician or provider. Our first topic: current active cancer, primary. For 200 points, patients identified as having cancer and receiving active or definitive treatment for the condition should be reported how?
As active cancer patients with the appropriate neoplasm code until they have completed their treatment.
Correct. For 400 points, active or definitive treatment is defined as...
Active or definitive treatment is defined as surgery, immunotherapy, chemotherapy, and or radiation therapy aimed at eliminating the malignancy.
Correct.
Well, now, I'm not entirely sure my buzzer's working.
Well, you're in luck, because we've got a bonus question worth 600 points. Name an additional circumstance under which a patient might be coded as having active cancer, but is not receiving active or definitive treatment for it.
When active treatment is refused.
One at a time, please, one at a time.
When active treatment is refused.
Adjuvant therapy.
Treatment for symptoms such as hospice care.
Jerome, show us refused treatment.
I told y'all I was gonna win.
And adjuvant therapy.
You were saying, Dr. Sanders?
Now, this is an important point. Cancers with documentation stated as history of XXX cancer on current adjuvant therapy or other active treatments should have their documentation corrected to read active XXX cancer and should be coded as active cancer. For example, a patient with history of breast cancer on adjuvant therapy should be coded as active breast cancer.
Indeed.
Last, show us treatment for symptoms such as hospice care. For 1,000 points, who can give me an example?
Example: a patient with brain cancer receiving hospice care is coded as active cancer.
Dr. Jenkins is in the lead. Now, for 2,000 points, when should you use personal history Z codes?
When there's no evidence of any existing primary malignancy or the primary malignancy has been excised or eradicated.
Also, when there is no adjuvant treatment, chemotherapy, or radiotherapy directed to the site, or there is no evidence of recurrence of the primary malignancy.
And don't forget, quite simply, if the documentation states that there's no evidence of disease.
Yes, splendid. Let's see those answers on the board.
Now, who's in the lead? I didn't do too well in math class.
Final question. Patients with no history of cancer who take prophylactic cancer drugs should not be reported with an active cancer diagnosis or a personal history of malignant neoplasm. How should they be documented?
Document and code the reason for the prescription.
Correct!
Great! Did I win?
I think we can agree that you're all winners today.
You forgot to order the prize again, didn't you?
Yes. Yes, I did. But tune in next week as our doctors compete for another fabulous prize that is definitely real and yet to be determined. Good night, everyone! These links will take you to the ICD-10 CM guidelines, the 2017 crosswalk of codes to HCC and RxHCC categories, and to the most current listing of ICD-10 CM codes on the CMS site. Please feel free to muck about in them for clarification and further edification.